current COVID-19 pandemic, the safest way to reach out to you and share important information is through social media like YouTube. The greatest myth about hospice is someone only goes on hospice right before they die. And while hospice is often recommended late in the disease process, for best results in patient care, family support, end-of-life and education, bereavement services, earlier is best. Hi, I'm Lisa Ward, and I represent the VNA, the Visiting Nurses of Philadelphia. And the rule of thumb we use is this: would it surprise you if a particular patient was no longer here in a year? If it wouldn't surprise you, then it is time to start that conversation. Let's call it Hospice 101. I'll answer questions such as, when should hospice be recommended? What qualifies a patient for the hospice benefit? How to make a referral? Who makes up the hospice team? And lastly, who pays for the hospice benefit? Now stay with me because we're going to be talking about the basics of hospice care. The number one question I get all the time is, when do you recommend hospice for a patient? Well, when curative treatment is no longer working or when a patient decides they no longer wish to pursue a curative treatment. This is the time to have that crucial end-of-life conversation and recommend hospice early in the process. What makes someone appropriate for hospice? The guidelines involved are, you must have a 6-month or less diagnosis and it must be disease-specific. Most common are end-stage Alzheimer's, adult failure to thrive, end-stage CVA, end-stage CHF, COPD, metastatic malignancies, and these are just to name a few. If you need a complete list of qualifying diseases, I can provide one for you. If you're unsure about the hospice diagnosis, the VNA will provide an RN to go to the patient's location and complete a hospice evaluation. So if you've identified a patient who is no longer seeking aggressive treatment, has a life-limiting illness of 6 months or less, now is the time to make that hospice referral. Important best practice. For those patients that have had frequent hospitalizations, take the first step and make that referral before the patient goes to the hospital again. This will lessen the burden of uncertainty for the patient and their families. The VNA only needs 3 things. We need a patient demographic sheet, including insurance, clinical information, which paints a picture of what's going on with the patient, and a hospice order. Once the VNA receives this referral information, our team jumps into action. Our highest priority is keeping your patient safe and comfortable in their familiar surroundings. Now let's talk about our VNA team. The VNA team are professionals specializing in end-of-life care. Leading the team is our medical director, overseeing all aspects of care. An RN, a registered nurse, who manages pain and symptoms, and their goal is comfort. A CNA, a certified nursing assistant who takes care of the patient's personal needs. A social worker who helps guide the patient and their family with end-of-life arrangements, and a chaplain who caters to all patients' spiritual needs, whatever their denomination. This team of professionals is here to take care of your patients and families' physical and emotional needs every step of the way. Who pays for the hospice benefit? Well, the hospice benefit is paid through Medicare Part A, and there is no out-of-pocket expense to the family. So what's included? The hospice team visits that come directly into the patient's home. DME, any durable medical equipment such as a hospital bed, oxygen, specialized mattresses, wheelchairs, all medications that are related to the patient's hospice diagnosis, respite care for caregiver burnout, the VNA IPU, a 15-bed unit for patients with unmanaged symptoms. IPU, patient has symptoms we can't manage at home. The VNA sets up transport and brings the patient to our unit for symptom management. Once managed, the patient goes back home. Now that I've given you a basic understanding of how hospice works, I want to share with you one question that's followed me throughout the years. Why didn't anyone tell us sooner about the hospice benefit? Well, this is the reason why I'm reaching out to all of the physicians in the area to help bring a better understanding on what is available for your patients. We want to alleviate the pressure of this topic for you, your patients, and families. Let the VNA be an extension of your practice. Thank you. My name is Lisa Ward from the Visiting Nurses of Philadelphia. If you need any more information, my contact links are below. Bye-bye now.